Republicans open a congressional investigation into Minnesota Medicaid funding. A new report alleges antitrust violations by a major healthcare company. And Congress continues to make progress on finishing fiscal year 2026 appropriations. For the week of January 26, 2026. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
And I think everyone in this room understands what has just been done here. This isn't just a news conference. I would call it a celebration of sorts. Despite the noise, despite our slim margins, despite the fact that most members in the House have never gone through a regular member-driven appropriations process before, this team got it done. They stood together.
Kicking off this week's episode with news from Capitol Hill, where Congress has continued moving the appropriations process forward ahead of the January 30th deadline to avert a government shutdown, address health extenders, and fund federal agencies for fiscal year 2026. The following annual appropriations bills have been signed into law: Agriculture, Rural Development, Food and Drug Administration, Legislative Branch, Military Construction, Veterans Affairs, Commerce, Justice, Science, Energy and Water Development, and Interior Environment. The House of Representatives has also passed a Financial Services and Government National Security Department of State minibus package, a Defense, Labor, Health and Human Services, Transportation, Housing, and Urban Development minibus package, and a separate Homeland Security funding bill. The Bipartisan Consolidated Appropriations Act of 2026, containing the Labor, Health and Human Services Agreement and health extenders, passed the House on Thursday in a 341-88 bipartisan vote. It contains nearly $117 billion in discretionary funding for the U.S. Department of Health and Human Services, in line with fiscal year 2025 funding levels and rejecting the deeper cuts to HHS proposed by the President's budget request. The National Institutes of Health would receive $48.7 billion, providing a modest increase. The report language contains new guardrails around the use of multi-year funding by NIH and would prohibit altering, quote, the manner in which negotiated indirect cost rates have been implemented and applied under NIH regulations, unquote. The Labor, Health and Human Services spending bill also includes provisions to reform the pharmacy benefit manager industry, including new pricing and distribution disclosure requirements and provisions to de-link PBM's compensation from the cost of Medicare prescription drugs. The package also extends key healthcare programs, such as the Medicare Dependent Hospital Program, Medicare telehealth flexibilities, the Acute Hospital Care at Home waiver, and virtual cardiopulmonary rehabilitation services. Despite this progress, the likelihood of a partial government shutdown increased over the weekend, with Senate Democrats vowing to oppose funding for the Department of Homeland Security in the wake of the Immigration and Customs Enforcement shooting in Minneapolis on Saturday. The chamber had been expected to take up a 6-bill spending package, including both Labor, Health and Human Services and the Department of Homeland Security funding, within the coming days. Senate Majority Leader Chuck Schumer has stated that Democrats will not help advance the package as long as it includes DHS funding. Democratic support will be required to clear the 60-vote procedural threshold. The situation is further complicated by the winter storm affecting much of the country, keeping the chamber out of session until at least Tuesday. More news today, where Republican leadership of the House Judiciary Committee has released an interim staff report detailing the results of an investigation that began in 2024 into the business operations of CVS Health. The report accuses the company of possible violations of antitrust law, alleging that CVS discouraged independent pharmacies from working with competitor companies. The committee details how CVS acted to stifle innovation and reduce competition from hub pharmacies. According to documents produced by the committee, CVS, quote, developed plans to establish its own suite of digital pharmacy services, and then, instead of competing with hubs on the merits of their services, prevented independent pharmacies from using pharmacy services from hubs, unquote.
I've family that live in Minnesota. It's a wonderful state, and I know that they are angry, that they're very frustrated. So I think that we talk about the amount of money that's being wasted, $9 billion. That seems like an abstract amount, but let's break that down. $9 billion stolen from less than 6 million citizens of Minnesota, correct?
Republicans on the House Energy and Commerce Committee have opened an investigation into recent findings of Medicaid fraud in the state of Minnesota. Representatives Brett Guthrie, the chairman of the House Energy and Commerce Committee and a Republican from Kentucky, John Joyce, a Republican physician from Pennsylvania, and Morgan Griffith, a Republican from Virginia, have sent a letter to Governor Tim Walz requesting information related to the state's efforts to combat Medicaid fraud. The letter reads, quote, "The swath of criminal schemes coming to light in Minnesota include overbilling, false records, identity theft, and phantom claims in Medicaid social service and health programs for the elderly and disabled, people struggling with addiction, and homelessness." The letter goes on to say, to inform the committee's oversight and potential legislative reforms, we are examining the extent of Medicaid fraud in Minnesota and actions the state has taken and is taking to strengthen program integrity. Unquote. House Oversight Committee Chairman James Comer, a Republican from Kentucky, also announced plans last week to expand his panel's investigation into findings of fraud on Minnesota's social services programs. Comer is requesting that the temporary commissioner of the Minnesota Department of Human Services appear for a transcribed interview before the end of the month.
The CARES Act was one of the starkest examples in recent years of why Congress should grant statehood for the District of Columbia. The Republican-led Senate intentionally.
Final news today, where D.C. Delegate Eleanor Holmes Norton, a Democrat, will not seek re-election in November. Norton has served as the District of Columbia's non-voting delegate in the House of Representatives for more than 3 decades. Her campaign filed a termination notice with the Federal Election Commission over the weekend. She currently sits on the House Committee on Oversight and Reform and the Transportation and Infrastructure Committee.
Good morning and welcome everyone to the organizational meeting for the 119th Congress.
And I welcome everyone to the first Help Committee meeting of the 119th Congress.
Good morning and welcome everyone to the first meeting of the House Committee on Energy and Commerce of the 119th Congress.
The Finance Committee will continue its long tradition of addressing these matters in a manner that invites bipartisanship.
We end each week's episode with the Call to Order, where we lightning round congressional meetings and hearings in the near future that you need to know about. First, on Wednesday, January 28th at 4 p.m., the Senate Veterans Affairs Committee holds the hearing, Building a 21st Century VA Healthcare System, assessing efforts to restructure the Veterans Health Administration. And last, on Thursday, January 29th at 9:30 a.m., the Senate Special Committee on Aging convenes a hearing titled Truth in Labeling. Americans deserve to know where their drugs come from. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.